I'm John Strum, and this is Real Talk MS. It's July 8th, and we have a lot to talk about. This week, we're wrapping up our coverage of the Digital Tools Workshop, hosted a couple of weeks ago by the International Progressive MS Alliance. This workshop brought together an expert group of scientists, clinician scientists, and people living with progressive MS to explore the role that digital tools play in MS research today, and to consider the many different ways that digital tools will impact MS research and MS care in the very near future. But before we get to the Digital Tools Workshop, we have to spend a few minutes talking about the so-called Big Beautiful Bill passed by Congress last Thursday and signed into law on the 4th of July. Please don't be confused by the political rhetoric. If you're affected by MS or any chronic illness, there's nothing beautiful about this bill, which cuts nearly $1 trillion from Medicaid. The nonpartisan Congressional Budget Office indicates that as a result of these cuts and changes the bill makes to the Affordable Care Act, over 17 million Americans will lose their health care coverage over the next several years. It strikes me that talking about $1 trillion and millions of Americans is pretty abstract. Even talking about Medicaid itself can be pretty abstract. Because Medicaid is administered by each individual state, it goes by many different names, and that can create some real confusion. This was made very clear to me last week when I read a social media post by a father living in Iowa who was relieved and grateful that his daughters weren't covered by Medicaid. They were covered by a healthcare program called Hawkeye. This father didn't understand that Hawkeye is Medicaid in Iowa, just like it's Denali Care in Alaska, Health First Colorado in Colorado, Diamond State Health Plan in Delaware, MedQuest in Hawaii, Hoosier Healthwise in Indiana. I could keep going, but I think you get the idea. Millions of people receive Medicaid benefits under a variety of names, and several million of them will find themselves losing those benefits. But the crisis this creates is much bigger than individuals. Hospitals, especially hospitals in rural communities or in economically disadvantaged communities, rely on this funding to keep the lights on. But as I said a moment ago, the devastation in this bill, the harm that this bill does to millions of Americans, is partially hidden behind numbers that are so big, it becomes difficult to really process what this is going to do. So health statisticians at the Center for Infectious Disease Modeling and Analysis at the Yale School of Public Health and the Leonard Davis Institute of Health Economics at the University of Pennsylvania have calculated how the cuts in healthcare funding in this big, beautiful bill will actually impact people. They estimated the number of people who could die unnecessarily based on 3 effects of this bill, and they were able to determine that this bill would result in 42,500 unnecessary deaths annually. That's 11,300 deaths from among the 7.7 million people losing Medicaid or Affordable Care Act marketplace coverage. 18,200 deaths due to the loss of Medicaid coverage among 1.38 million low-income Medicare beneficiaries, causing them to lose access to low-income prescription drug subsidies. And 13,000 deaths among Medicaid enrollees in nursing homes, due to the rollback of CMS 2024 nursing home minimum staffing rules. That's 42,500 deaths annually. And those numbers weren't pulled out of thin air. The health statisticians used peer-reviewed estimates of the relationship between mortality and the loss of Medicaid coverage for adults between the ages of 19 and 64. The loss of medication coverage for low-income Medicare beneficiaries through the low-income subsidy, and rescinding minimum nursing home staffing levels for total nurse staffing hours per resident day, These peer-reviewed numbers were applied to the number of people at risk from the funding cuts in the Big Beautiful Bill. But wait, there's more. Because the bill fails to extend the Enhanced Affordable Care Act premium tax credits, the expiration of that policy is expected to lead to the loss of insurance for another 5 million people. That change alone is expected to cause an additional 8,811 deaths annually, bringing the total to 51,000 unnecessary and preventable American deaths each year. And why have our legislators decided to sentence over 50,000 Americans a year to unnecessary and preventable death? Well, it helps pay for a tax cut that will, according to the Yale University Budget Lab, provide the top 20% of earners in this country a $6,055 benefit. That's the real-world math that explains the cost and corresponding benefit in the Big Beautiful Bill. And we haven't even gotten to the reality that, according to an analysis published by the Commonwealth Fund, at least 300 hospitals located in rural communities are at risk of immediate closure. It's estimated that over 3 million people living with disabilities live in rural communities. You can do the math when it comes to the day one of those 3 million individuals needs immediate care. I've heard people on both sides of this bill use the same phrase, and I happen to agree with them. Both sides want to remind us that elections have consequences. And I'd like to remind you that all 435 members of the House of Representatives and a third of the Senate will be up for re-election on November the 3rd, 2026. That will be the day that collectively we can hold each member accountable for their vote on this bill. And I plan on voting for candidates who have consistently supported the MS community, not by their rhetoric, not in their speeches, but by their legislative actions. Advocacy has always been an important part of this podcast, and you can be sure that's not going to change between now and November 3rd, 2026. This is simply a reminder that MS activists are going to vote, and we're going to remember who supported us and who didn't. But it also doesn't mean we're losing our focus on discussing the encouraging and potentially life-changing MS research that's taking place all around the world. To share an example of how a digital tool can improve the quality of care, consider an appointment you might have with your neurologist or MS specialist. When they time your 25-foot walk or test your cognition, the results might be different if your appointment is at, say, 9 o'clock in the morning instead of 3:30 in the afternoon. The results could be different if it's a cool day in September instead of a hot and humid day in July, or if it's a day after you've had a good night's sleep instead of a day following a night when you've experienced difficulty getting that good quality sleep. And by the way, your neurologist is going to be limited to capturing that information and evaluating your status on the particular day once or maybe twice a year when they happen to see you. What if instead there was an app that lived on your smartphone or smartwatch, and you didn't have to manually enter anything? This app just sort of hides in the background and records information about your MS symptoms, like your balance, your gait, your cognition, even your mood. And it sends that constant stream of data to your neurologist's office, where an AI application automatically reviews all your data and sends an alert to your neurologist when it senses a change in your status, or better yet, when it predicts that a change is going to occur. This gives your neurologist a chance to intervene, maybe recommend changing up your disease-modifying therapy or possibly adding some physical therapy sessions to your treatment plan. This kind of a digital tool will allow you and your neurologist to be proactive instead of reactive when it comes to your treatment plan, giving your neurologist an opportunity to personalize your treatment based upon having this real-world, real-time profile of how you're doing. And by the way, all of this has happened without you having to show up for an appointment with your neurologist. It's a vastly improved level of personalized patient care without burdening the patient with additional tests or appointments, giving you more time to simply live your life. That's just one simple example of how digital tools will improve the quality of MS care. And when it comes to MS research, digital tools will have an equally profound impact on making clinical trials shorter, which means discovering what's working faster, and that means providing access to better therapies sooner. Digital tools can also make participating in clinical trials less burdensome for trial participants, while reporting lots more relevant data to researchers. As I hope you can tell, I came away from this workshop excited about the kinds of gains we're going to see as digital tools are brought online in the clinic and in the laboratory. One of the many aspects of the International Progressive MS Alliance that I especially admire is that from its earliest days, the voices of people affected by progressive MS have been a fundamental part of the Alliance. The Progressive MS Alliance Scientific Steering Committee includes people affected by progressive MS among its members, and the Alliance's People Affected by MS Engagement Coordination Team ensures that the patient voice is well represented in all of the initiatives launched and overseen by the Alliance. Vanessa Fanning lives with progressive MS and chairs the Alliance's People Affected by MS Engagement Coordination Team. During the second day of the workshop, Vanessa gave a presentation sharing her perspective on how digital tools will benefit people with progressive MS, while also pointing out some of the challenges that need to be addressed. In a moment, you'll hear my conversation with Vanessa Fanning. Vanessa Fanning is the current chair of the International Progressive MS Alliance's People Affected by MS Engagement Coordination Team. And earlier this afternoon, Vanessa shared her perspective as someone living with progressive MS on using digital tools as interventions for progressive MS. Vanessa, early in your presentation, you mentioned that digital tools have the potential to identify a variety of useful information, both to a clinician, a researcher, even a patient. Aside from the potential to identify and communicate that information, do you see them at this point reaching their potential?
Oh, I do think that they'll reach their potential. I think there's a lot of very exciting work going on with digital tools and such advancements in technology. But what I think is underestimated by the researchers is that a lot of people, the majority of people living with progressive MS in particular, face huge challenges just in managing their daily lives. And as we often say in our peer group, managing my MS is a full-time job. So there has to be a real perception of value coming out of the use of a digital device compared with the burden, because sometimes what's being expected by people who are promoting digital devices, whether they're wearables or apps or questionnaires, is they underestimate how difficult and challenging it might be for someone who suffers from fatigue and maybe cognitive deficits and lack of ability to concentrate. So I sort of, when I was talking to this audience, I said that digital tools have to be affordable and accessible. And so it's very important that they don't impose a significant burden, that they impose a low burden, in fact, and demonstrate high-value results. So ideally, they'll require zero or minimal specific allocation of time or effort. They need to enhance a sense of self-efficacy and enhance rather than undermine self-esteem. They need to be easy to use in terms of wearability, complexity, dexterity, the availability of IT platforms and IT skills, and ideally, and I think this is quite important, provide validation of invisible or poorly recognized or measured symptoms, because that's what it's all about, really. We're often trying to explain to our neurologists what's going on with us when the neurologist says, your MRI hasn't changed in the last 12 months. You're doing great. You're stable. And we know we're not. And this is where digital tools, I think, come in, that they can measure subtle progressive changes. And that provides the opportunity to open up a dialogue and talk about, well, what do we do to address these changes?
You brought up something that I think about a lot. You mentioned that digital media as digital product that people can consume. You mentioned that in spite of relatively strong audience numbers, most people living with MS don't consume digital media. So I'll ask you a question I ask myself very often. What do we do about that?
I think it's very hard. I think it's just lack of awareness, and somehow you've got to get the message out that this is very accessible. This is a very accessible way of learning more about MS and perhaps collaborating with colleagues, and that it can be, you can stop and start and suspend whenever you like. You can do it in your own time. It's not a burden, but I think it's often the case that people, they can just flick on their TV and switch off, and listening perhaps to a more thoughtful blog or podcast that's talking about developments in research or developments in knowledge about MS. It requires a bit more effort, and I think the only way we can get people to adopt these more is to raise awareness, and for people who do listen to wonderful podcasts such as Real Talk MS, that they get the message out and talk to their friends and peers and their organizations and encourage people to listen.
Well, thank you for those very kind words, by the way. Obviously, that insight you shared really struck a chord with me. I think knowledge is power, and it is empowering to know more about the disease that affects you. I think that there's opportunities for self-advocacy. I think there's lots of good things. And I think that when you hear about some of the remarkable research that you certainly hear about all the time, you're hopeful about the future. And that's not a bad thing either. So I strive to reach more folks every single day. And I wish I could say it was easy, but I think it's important.
Yeah, I think it's very important too. And I think you're absolutely right. If you can get people to connect with your podcast, it generates hope and it generates excitement, and it does provide knowledge. And also, I know from listening to your podcast, you also sound warnings from time to time when there's maybe a fad going on or misinformation spreading around. It's really important to have really reliable, well-researched, well-grounded, evidence-based material on these podcasts. And I think you've managed that extremely well, and it's so important. But you're right, there are so many people that it's difficult to connect with, not only for people such as yourself, but for researchers and for MS organizations. We all face this challenge of how do you connect with people who are living in really disenfranchised situations.
And that really brings me to the last question I wanted to ask you, because something else you said really touched me. You implored the audience at the workshop to remember the silent voices. And you pointed out correctly that depression can get in the way of somebody deciding to listen to a podcast, deciding to pick up a digital device and use it, deciding to walk out their front door. I have often described MS-related depression is that 800-pound gorilla that sits in the middle of your living room and blocks you from getting out the door because you just lose interest in getting out the door. How do we fix that?
Oh, it's very difficult and it's very real because MS, particularly progressive MS, when the symptoms progress and it becomes difficult to walk, when you may have impaired hearing, impaired and certainly crippling fatigue and difficulty just managing the very, very basic aspects of your life. It's just so difficult to get out the door. It's not only depression that's stopping you, it's the logistics, you know, if you have to organize a wheelchair taxi and all those sort of things. And so it is hard to reach those people. And I don't know that there's easy answers to that.
I always admire the commitment that you demonstrate, and so many others. I've shared with my listeners that we were very, very fortunate to have several members of the people affected by MS engagement team here. You are one of the people who are sharing their own perspectives on the information being shared over these 2 days. I think that's wonderful, but I know how tough it is to just show up sometimes.
Yeah, that's absolutely right. You know, the impact of fatigue and the difficulty concentrating. You know, we lack time and energy. People living with progressive MS do face so many challenges. So setting aside the time to come to a conference like this is significant, but we can also see that we're having a significant impact. People are listening to us, and I really admire the way the Alliance goes about its business because they really do go to great lengths to support the engagement of people with lived experience, and they listen and they respond and they incorporate our views. And I have to say, I really think we've influenced the work of the Alliance in a very positive way. We've helped frame the priorities, the research priorities, the strategies, the directions. We help evaluate the applications for funding, and it's a really meaningful role. And I think everyone should, at very least, try and engage with the Alliance's website, and also put their names down to receive the updates that come out about once a quarter, talking about the breakthroughs in research that are being achieved. It's pretty exciting.
I will co-sign everything you just prescribed. Vanessa, I always enjoy talking with you. Thank you so much.
Thank you very much, John. It's just lovely to see you again.
Professor Sergio Baronzini is a geneticist, neuroimmunologist, and data scientist who's focused on using so-called big data to better understand multiple sclerosis. Just last year, Professor Baronzini was a recipient of the Barancik Prize for Innovation in MS Research. And if you're a regular listener, you might recall my interview with Professor Baronzini in episode 344 of this podcast. Digital tools generate data. Lots and lots of data. So it's important to have platforms and tools designed to manage and analyze this tremendous amount of data. At the workshop, Professor Baronzini was part of a panel presentation on data analysis. Following that presentation, I had an opportunity to talk with Professor Baronzini about how digital tools will be integrated into MS research and care. In a moment, you'll hear our conversation. Professor Sergio Baronzini is a geneticist, neuroimmunologist, and data scientist at the University of California, San Francisco, where he holds the Heydrich Friends and Family Endowed Chair in Neurology. Professor Baronzini, what do you see as the major barriers to using digital tools in MS research?
Well, thank you for having me. So one of the challenges that I see is adoption, consistent adoption. and implementation across a diverse group of participants. Sometimes studies are focused on accumulating enough data, enough participants, but it's important also to keep in mind that the target is a diverse population, so that any conclusions that are drawn from that study can be implemented and applied to everyone with MS.
When I spoke with another presenter at this conference, Dr. Jennifer Graves, we talked a little bit about a device she was actually testing in her lab. And I commented that listening to her presentation, it sounded as much about engineering as it did what we typically think of in terms of MS research. And the reason I bring that up is I'm wondering, as a data scientist, you are quite comfortable with the concept of processing and managing big data. As more researchers are going to implement or integrate digital tools and the data those tools are going to collect, are they going to need to develop data handling skills?
Oh, that's a great question. And my short answer is yes. I think scientists all across the board now need to become literate in handling large amounts of data, whether it is themselves or having that expertise in their teams, or they'll have to collaborate with teams that have that expertise, because we're living in a world that we're not going to have any less data in next year. So I think we need to be prepared for that.
As we've been discussing digital tools for the last 2 days, a thought that's crossed my mind is one of the tools that I think is going to be needed both on the research and the clinical side is a digital tool to manage that data and provide that data to the end user, be it a scientist or clinician, in a meaningful way.
Yeah, absolutely. I think some sort of repository or dictionary of data sets and tools is needed, and I have quite a bit of confidence that that is going to become a reality, because with the new generation of generative AI methods, this is going to be one of those benefits that this powerful algorithms will be able to identify the tools and catalog them and organize them in a way that are accessible for the people who needs them. So I think this is going to be one of the benefits of these new AI tools.
How do you see, or do you see, the availability of digital tools impacting MS research?
Well, I think that we're living in a very critical time in history, and this also impacts individuals living with MS. We're living in an unprecedented time in where new tools, digital and otherwise, but mostly digital, are being developed and presented to us on almost a weekly basis. And it's naturally difficult to keep up with all the progress. So I think that we're going to live in a transition period for a while, where we need to adapt to this caudal of new tools coming our way until the dust settles a little bit, and the most important and the most useful and the most user-friendly tools emerge and people adopt them. So it may take a while until this happens, but I think it will happen, and the winners will be clear, and people will adopt the winners until the next great tool comes up, because that's evolution of digital tools.
When I think about how digital tools may be introduced into MS care, and I think about the patient experience, one of the things I wonder about is, how do we ensure equitable access?
I think it's as important as challenging. Equitable access is important not only for MS, but all across the board. And we have many examples of good intentioned but ill conceived tools that were very successful, but only benefited a subgroup of our entire population or community. So I think that equitable access to tools starts with the design of the experiment. It should not be an afterthought. Now we have all this data. How do we make it equitable? The equitable part needs to come in the design phase, so that who are we gonna collect data from? Because we're gonna train models with data, and if those participants that we choose to be our data generators for training our models are not diverse enough, are not going to generate a distribution of possibilities across the community, guess what? The models will not apply to those people.
Well, Dr. Sergio Baronzini, I want to thank you for all you do that benefits so many people in the MS community around the world. Thank you so much for taking a few minutes to talk with me.
Thank you, John. It's a pleasure.
Dr. Ruth Ann Mary is the Vice Chair of the International Progressive MS Alliance Scientific Steering Committee, and she also served as the co-chair of the Digital Tools Workshop. Right after Dr. Mary adjourned the workshop, I had an opportunity to get her perspective on the information presented and the issues that were raised over the course of the workshop. I even asked Dr. Mary to gaze into her crystal ball and share her thoughts on the next steps that would be necessary to integrate digital tools into MS care and research. In a moment, you'll hear my conversation with Dr. Mary. Dr. Ruth Ann Mary is a professor of medicine and the Multiple Sclerosis Clinical Research Chair at Dalhousie University in Canada. Dr. Mary is also the vice chair of the International Progressive MS Alliance Scientific Steering Committee, and she's the co-chair of the Digital Tools Workshop that the Alliance has hosted over the past couple of days. That workshop was just adjourned a few minutes ago. Dr. Mary, it's always a pleasure to talk with you. I'm hoping you can give us a 30,000-foot view of what was covered at this workshop.
Thanks so much, John. So I'm really glad to talk to you again, and it's a really exciting meeting. So when we started talking about this meeting, we're like, well, what are we going to talk about? And you start to think about, well, digital tools are everywhere, right? So it's in your smartphone. It's when you do telehealth with your physician. You know, it's when you say, Alexa or Siri, help me with whatever. So we're really aiming to try and move our understanding forward of how we can get a handle of how are digital tools being used in the space for multiple sclerosis, and what can we do to move things forward for people with progressive MS. And so, you know, our objectives were, among other things, you know, we recognize that the current tools we have to measure progression are not satisfactory, right? They're not sensitive enough. Somebody can tell me that they're worse long before the measures that I have to tell that show it. And so that means when we do our clinical trials, for example, that we may miss things. So the trials need to take longer. We need more people, but also we might miss interventions that actually could help people because we just haven't looked long enough, or the signal's too small for our poor tools to pick up. So one of the nice things we talked about at this meeting is, what are the pathways for us to use some of these other tools to get them really into a state where we could use them in our clinical trials to move things along faster. And then to talk about what other things do you need to facilitate that and use of those types of tools, not just in clinical trials, but in clinics, so that the clinician can pick up those changes that the person in front of them is telling them about, so they can make a joint decision to improve care. And so we talked a lot about, you know, we need a common language because there's all the different platforms along. We all use different words, so we need to be able to communicate together. And we had a lot of discussion about the tool needs to be fit for the purpose of the person who's using it. And that means that you need to include the person with MS in the development of whatever tool or intervention there is from the beginning. And because if it doesn't work for them, they're not going to use it. If you want the clinician to be using the tool in some way in the clinic, you need to make sure that they can actually get the information off the device. They can come up with some way to use that information and integrate it. So they're a user that you need to consider. And the technology, we talked a lot about how can we future-proof ourselves. So if we do all this work on a tool, that the platform doesn't change in 6 months and we can't use it anymore. So there was a lot of discussion about the need for global collaboration. So people with MS, the clinicians, the engineers, the data scientists, industry, commercial platforms, health systems, we really need to work together to come up with that vision for the future. But I think my feeling was there was a lot of goodwill in the room about, yes, we actually all recognize there are problems and things we need to solve from each of our own perspectives, but that we really can't get there unless we do that together. And I think that's been one of the values of the Alliance, is bringing lots of different people into the room. And so I think that really spilled over into this meeting.
I agree with you. I think that really the signature of the Alliance is the collaboration that we've seen at this meeting and that we've always seen from work that the Alliance has been doing. One of the things that truly impressed me, and it's also something that has consistently been a part of what the Alliance does, is during this meeting, from literally beginning to the very end, there was participation, there were presentations made by people who were living with progressive MS.
Yeah, so that was a really deliberate choice, because the idea that we're going to make tools for somebody who has no say in it is going to lead to failure. And I think for a lot of people in the room who don't have the opportunity to interact with people living with MS when they're maybe doing the data analysis or thinking the additional platforms and some of those things, really brought home for them the difference in perspective that they might have about what's useful as compared to the person with MS. So we heard a lot from our presenters, from our engagement coordination committee, about people wanting to get something back. So they needed to know why they were using the tool, either seeing a result or knowing why it was of value in their care, and that if that's not there, they're not going to persist with using the tool. And that people don't want to use tools endlessly. They'll give you a certain amount of time if that is commensurate with the value. And if the value is low, then you can't expect people to spend, a huge amount of their time. So, one person who presented polled people and said, well, you can have about 3 minutes, 3 or 4 times a week if it's low value to me. And I was like, okay, well, that's a pretty narrow window for us to get into. So we either have to minimize the burden or we have to get a lot more value into the tools that we're creating. And I think that really came home because that was kind of a consistent piece. The other thing we got out of the presentations from our people affected by MS was, I think, the importance of personalization. So not all outcomes are equally relevant to every person or equally relevant at the same point in their disease course. So being able to allow some personalization, to allow people to choose what's important to them, is something that we need to think about incorporating. So I think a lot of those thoughts will come into sort of our next steps as we think about how to share this information.
If we can look into the crystal ball that I'm sure you carry in your pocket with you, how do you see digital tools in general, or perhaps a tool specifically that you might consider? How does that change MS care? How does that change what happens in the clinic?
Yeah, so that's a great question. So with my crystal ball, I think, one of our speakers talked about really extending our neurological exam, that assessment, to include other tools. There's already a good example of that. So when we think about the tool of what we call electromyography and nerve conduction studies, we're actually really extending the neurological exam with a tool that allows us to do a deeper interrogation. I still have to rely on knowing where the problem is and all of that neuroanatomy and neurophysiology, but it allows me to really say, okay, well, it's this nerve or this muscle. So there's already a precedent that's historical, and so why can't we begin to think about these tools as those extensions of the neurological exam? So if somebody's telling me that they can no longer walk as far, or they feel like their gait quality deteriorates, why can't I add that digital tool if my routine and clinic measure doesn't work? I can say, well, actually, I need to go to the next step and get that more sensitive measure, because then if I can detect that change early, then maybe we make an earlier decision about whether we need to change a disease modifying therapy, or maybe we need to change a rehabilitation program so that we can focus on a different set of targets or get somebody reconnected to their rehabilitation team. So it gives us, I think, the opportunity to make more informed decisions, and that gives us more choices in a timely fashion. And I think that, it's a big challenge when we're dealing with progressive MS, right? Is we're like, okay, well, we recognize it after the fact. And so the opportunity to potentially figure that out earlier means maybe we can make change earlier, and maybe we'll make progress faster.
While you have your crystal ball out, and I'm not holding you to any of these predictions. I may remind you of them, but I won't hold you to them. What do you see as next steps? I think this meeting will be looked at in retrospect as that was the meeting in Philadelphia where embracing digital tools, making them a priority so that they can deliver the kind of care you just gave as an example. That happened here. What happens next?
Well, there are some simple steps, which is we're going to try and summarize a lot of this content so we can share it with the people who weren't at this meeting as a starting point. I think as a community, I'm hoping one of the things we can do is get together and actually say, well, if we need a set of standards to evaluate tools, that we actually start doing that so that everybody can adhere to those, that we build the common vocabulary and put it out there so we're all talking the same language. And then I'm hoping that we can take advantage of the sort of unique partnership of all of the different industry partners who are all involved in using these tools and developing them, as well as our engagement coordination team and the clinicians and researchers, to say, well, really, can we get to agreeing about a common platform to really openly sharing the data, the tools, the analytics, so that we have a common space. Now, those things take time to build trust and those kinds of things. But I think if we can move to that really open, what we call the fair data principles, so data are findable, they're accessible, they're interoperable and reusable in this space, then that will allow us to move forward much more quickly. And it will reduce the chances that there are 200 apps about managing fatigue, but there's nothing helping somebody understand how to manage their spasticity or their pain. And so I think they may seem like small things, but I think if we can get those started, that puts us in a position to really tackle the bigger issues that we brought up at this meeting.
Well, Dr. Mary, I want to thank you for co-chairing such an amazing meeting. Every single person walking out of the ballroom today commented on this meeting was different. In this meeting, everybody participated. In this meeting, people are taking away lots of new ideas. Thank you for co-chairing such an incredible meeting, and thanks for spending a few minutes talking with me.
Thanks so much for having me.
That's going to wrap up this episode of Real Talk MS from the International Progressive MS Alliance Digital Tools Workshop. Real Talk MS is powered by the National MS Society, and you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/410. You'll find that link in today's show notes so you can easily copy and paste it right into an email or a text. And if you have a minute, I hope you'll visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the best way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to access any of our past episodes. You'll be able to save your favorite episodes. And it's a great way for me to share bonus content with you. The app is free, so I hope you'll download it today. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.